All right, John. I also saw another thing that came up on MFR Insight not long ago where somebody said that their son was run over by a car, and so far no broken bones were found, only soft tissue injuries. And I know that I see that in my practice where people come in and sometimes the patients themselves are kind of confused, or maybe the family members or sometimes even the doctors because they have a very high level of pain, but they're being told, but there's no broken bones. It's only soft tissue. So do you mind speaking to that?
Yeah, this is very important. That post jumped out at me too when she said only soft tissue injuries. Um, so it's important. Obviously, we want to look for fractures and growths and bony abnormalities, but the soft tissue in many traumas has been shredded beyond recognition, and they're saying only soft tissue injuries. So uh, we'll put up a picture. One is a dog, a picture of a dog. Tisha is one of the wonderful therapists that works for me at Therapy in Rocks. She has this puppy, he's about a year old now. His name is Rex. I put something on the M4 Insight a while back. And he had a dislocated hip and he's having trouble walking and jumping, as a young puppy should. A lot of pain and exhaustion when you take him out for a walk. So she took her to the vet. The vet took x-rays and said, well, the only thing we can do is surgery. We can't guarantee that it'll work, and it'll cost you over $3,000. So she took Rex over to my home, and we treated Rex, and he was very cooperative, very nice dog. And we talked about the follow-up care for Rex, and she followed up beautifully with him. And he's now running, jumping, and not exhausted after runs. But as you look at the X-ray, I don't have it in front of me, but I can remember it pretty much. As you look at the X-ray, you can see it looks like both ilia are shaped differently. In actuality, what you're seeing is a torsion of the pelvis. And you can see that one of the acetabulums is low, functionally like in the leg, shearing of the pubic symphysis. But what you don't see is all the fascial restrictions now around that kept this femoral head from going back into the acetabulum. So with just a short amount of treatment and practically no money, Rex is now back to a very healthy puppy again. I see this a lot with veterinarians, but I see it also with regular radiologists too. Peter Pavelski, like kiddingly called a Polish prince, uh, is a great therapist, and he recently put on a post on MFR Insight about a young lady. She was 3. He said when she was diagnosed with torticollis. So we'll show you those pictures too. And he said when she had seen many doctors and therapists, nobody was producing any positive result. The next step was possible surgery of her sternocleidomastoideus. When she came in, she was clutching her father. She was terrified and in horrible pain, and her neck was severely side bent and rotated to the right. You can see her whole cervical column was just compressed considerably. So Peter treated her for a very short period of time. You can see the magnificent result. He changed her life. Myofascial release for all of you changes people's lives. It's true healing. It's authentic healing. Thank you.